You're in the middle of an intimate moment and suddenly the penis loses its rigidity. This can cause frustration and affect confidence, but understanding the causes of this situation is the first step toward overcoming the problem. I am Dr. Lais Costa, urologist, and today I will explain what really happens when this occurs during sex. Several factors can interfere, such as stress, health conditions, and even medication side effects. Identifying the root cause of the issue allows you to find ways to improve performance and prevent it from happening again. With clear and accessible information, you can regain your peace of mind and positively transform your experience. Before we continue, check if you are already subscribed to the channel to not miss more tips about health and sexual education. If you find the topic relevant, leave a like and participate in the comments. Type 1 if this topic made sense to you, or 0 if you have suggestions. Your feedback is important for us to bring better content. Every time the human body works as an integrated system that depends on precise signals to function. In the case of an erection, these signals start with sensory stimuli, something you see, hear, feel, or even smell. These stimuli activate the brain, which acts as a control center, sending commands to prepare the body. When this happens, the parasympathetic nervous system takes over. It is responsible for slowing the body down, reducing stress, relaxing muscles, and directing blood flow to specific areas, such as the blood vessels in the penis. These vessels dilate, allowing blood to flow efficiently, which generates and maintains the erection. It's like the body is a finely tuned mechanism where every part must work together for everything to function. However, if something disrupts this harmony, such as a negative thought or a distraction in the environment, the process can be interrupted in addition to proper stimuli. It is essential for the man to be relaxed and free of distractions, enabling the body to respond naturally and efficiently to these signals. Do you want to revitalize your sex life and strengthen the connection in the nervous system relationship in the digital book? Rediscovering Intimacy, Healthy Sexuality. After 60, you'll find practical tips to reignite desire, overcome obstacles, and build a deeper connection. Check out the link in the first pinned comment to discover how small changes can transform your love life. The nervous system is like an electrical control center that connects the brain and the body, ensuring everything works in perfect synchrony. During sexual activity, the parasympathetic system plays the leading role. It comes into action when the body is in a state of relaxation, sending signals to release chemicals that promote blood vessel dilation in the penis. This relaxation allows blood to flow and fill the corpora cavernosa, creating the erection. However, if the sympathetic system responsible for states of alertness and stress takes control, the effect is the opposite. It constricts the blood vessels, redirecting blood flow to other parts of the body, such as the muscles and heart, which prepare for fight or flight situations. In moments of anxiety, worry, or even surprise, the sympathetic system may interfere, blocking the erection process. For instance, a man might be in an ideal environment, but an intrusive thought, like remembering a financial problem, can trigger this state of alertness. In such a situation, the parasympathetic system loses strength and the erection may fail. This is why being relaxed and in a safe environment is essential for the nervous system to work in favor of sexual performance. Psychological stress acts as a true saboteur of sexual performance during sexual activity. The brain must focus on stimuli that bring pleasure, but when negative thoughts or worries arise, they take over. This happens because stress activates the sympathetic system, putting the body in a state of alert and inhibiting the parasympathetic system, responsible for relaxation and erections. External situations can trigger this blockage. An unexpected noise like someone knocking on the door or an unpleasant memory can activate emotional triggers that shift. Focus, for example, a man might associate a past uncomfortable experience with a current moment, causing tension and interrupting the erection process. In addition, everyday problems like overdue bills, family conflicts, or grief create an emotionally charged state when these worries enter the bedroom. Even subtly, they directly impact the ability to relax. A man may have received adequate stimuli at first, but stress becomes a barrier to maintaining performance. That's why mental health and the environment where the ACT occurs are so important to prevent stress from becoming a roadblock during the most crucial moments. Chronic diseases like diabetes and hypertension can directly compromise the mechanism that supports a healthy erection. With diabetes, the issue begins with the nerves and blood vessels, high blood sugar levels when uncontrolled damage. The nerves responsible for transmitting signals from the brain to the penis. Moreover, blood vessels suffer from hardening and reduced blood flow, impairing the ability to achieve and maintain an erection. Hypertension causes similar damage. Elevated blood pressure hardens and narrows blood vessels, over time making blood flow to the penis more difficult. This makes the erection. Chronic diseases process less efficient. Even in the presence of stimuli, additionally, medications used to control blood pressure, especially diuretics, can reduce erectile response when combined. These conditions further increase the risk of erectile dysfunction, particularly in men. Over 50, proper management of these diseases is essential to minimize their impact. Lowering blood sugar levels and maintaining blood pressure within healthy limits helps preserve the integrity of nerves and vessels, allowing the body to respond better to stimuli. During sexual activity, certain medications can significantly interfere with the quality of an erection. Even when stimulation is present, medications used to treat hypertension, such as diuretics, are common examples. While they help control blood pressure, they reduce the amount of blood that reaches the penis, making it difficult to achieve the necessary rigidity. Additionally, they may lower zinc levels in the body, affecting testosterone production, a hormone essential for sexual desire. Psychiatric medications, such as antidepressants, are also known to alter sexual function. They work on brain chemistry to regulate emotions, but often end up blocking sexual stimuli, delaying or preventing erections. This can be frustrating, especially for men already dealing with performance anxiety. Medications used to treat prostate issues, such as 5-alpha-reduce inhibitors, also have an impact. These medications lower testosterone levels, subsequently decreasing sexual appetite and directly affecting erectile response. In all these cases, it is essential to consult a doctor to evaluate alternatives or adjust dosage. Proper medical supervision can balance the treatment of the health condition with the maintenance of sexual quality of life. The use of medications like tadalafil and other options can be an effective resource for men facing erection difficulties. These drugs act as vasodilators, increasing blood flow to the penis, which facilitates the rigidity needed for sexual activity. However, to be truly effective, it is crucial to use them correctly and under medical guidance. Daily administration of low doses, such as 5 milligrams of Tatala, is a common strategy for men looking to improve their sexual response continuously. This method allows the body to maintain consistent levels of the substance in the blood, ensuring more reliable performance. On the other hand, occasional use taken before the ACT requires adequate timing for the medication to reach its maximum effect. Self-medication or increasing the dose independently is a dangerous practice. Overuse can lead to severe side effects, such as sudden drops in blood pressure and cardiac problems. Additionally, these medications only work effectively when sexual stimulation is present. Therefore, it is essential to combine proper use with the creation of a relaxing environment that allows the body to respond naturally to stimuli. Self-medication and overdosing on erectile medications can do more harm than good. Often the anxiety for quick results leads men to ignore medical recommendations, and increase the dose on their own. This can result in serious problems, since these medications like Tadalafil or Sofie have a vasodilator effect that in excess can compromise circulation and cause dangerous drops in blood pressure. When used improperly, these substances can lead to the opposite of the desired effect. Instead of improving penis rigidity, excessive vasodilation can reduce blood flow, causing ECA and impairing erectile response. Additionally, indiscriminate use can mask more serious health issues, such as cardiovascular diseases requiring immediate attention. Another risk is the development of side effects such as headaches, dizziness, and nasal congestion. In the most extreme cases, severe cardiac complications can occur. Medical guidance is essential to determine the correct dose, tailored to the individual's needs and health condition. Avoiding excess and following instructions are critical steps to ensuring the safe and effective use of these medications. Adjusting medications to treat erectile dysfunction is a critical step that must be done with medical supervision. Each body reacts differently to medications, and factors such as age, weight, health status, and the presence of comorbidities such as diabetes or hypertension directly influence the treatment response. What works for one person may not be effective or safe for another. Often, an initial standard dose, such as 5 milligrams of Tatala daily, may be sufficient for some men. While others may need adjustments, doctors evaluate the response to the medication and, if necessary, can increase the dose or recommend safe combinations of substances. This process ensures that the patient achieves the desired effect without taking risks for men who are taking other medications, such as diuretics or antidepressants. Medical monitoring is also essential to avoid interactions that could harm health or sexual performance. Doctors can suggest less impact F alternatives or adjust schedules and dosages. This personalized treatment not only improves results, but also reduces the risk of side effects, ensuring comprehensive care for sexual health. Specific lifestyle changes can. Lifestyle directly impact the quality of erections. One often overlooked factor is sleep quality. Poor sleep disrupts testosterone production and hormonal balance, both crucial for sexual performance. Creating a consistent sleep routine and prioritizing a calm environment for rest can lead to significant improvements. Additionally, proper hydration is another important factor. Dehydration can affect blood circulation and energy levels, impairing the body's response during sexual activity. Drinking water regularly helps keep the body functioning efficiently. Another practical adjustment is incorporating relaxation techniques into daily routines. Methods like diaphragmatic breathing or specific stretching exercises help reduce muscle tension and activate the parasympathetic system, promoting a more favorable state of relaxation. Lastly, engaging in hobbies that bring pleasure and mental relief, such as music reading or gardening, can enhance emotional well-being when the body and mind are aligned. Sexual performance reflects this harmony, creating a solid foundation for a more fulfilling and stable intimate life. Now that we've addressed the factors that can cause penile softness during sex, from emotional issues like stress to health conditions like diabetes and hypertension, I want to know which of these factors do you think impacts your life? Or someone you know the most, share your experience in the comments. It could help many others going through the same challenges. If you enjoyed the content, click like this. Gesture is crucial for more men to access information like this and take steps to improve their sexual health. Explore other videos on the channel for more tips about male health and sexuality. There's always something new that can make a difference, and if you haven't subscribed yet, take this moment to join our community that way. You won't miss any new content. See you next time.